Welcome to another conversation with Joe Reagan. Joe, I'm really concerned this big bad bill passed. How's that going to impact us vets? I mean, I
Yeah.
I'm really concerned because I'm looking at a bigger picture than what the article in the Gazette said.
Oh, well, yes. Well, and I actually had a long conversation with the reporter in the Gazette on that article because it's something that's coming up quite a bit. And the the big answer to the answer to the question is we really don't know yet. And this is what I think is the most unnerving is that the plans, the details are not existent in the plan. And for some of these, a lot of the actual impacts don't take effect until after the 2026 election. So already you have a bill that passed that the Republicans are claiming is a big piece, but many of the functions, many of the cuts that are going to impact not just veterans, but folks across the community, many of those don't actually come into full effect until after the 2026 election. And so what it has done is introduced a tremendous amount of uncertainty, both within the community of veterans, where veterans are now saying, well, am I still going to be able to get care? Is healthcare going to become more scarce? How is my disability payments going to be handled? And the unfortunate reality is every time we see uncertainty brought into the veterans affairs space, we see veterans less likely to pursue getting access to those benefits. So what you have kind of on the veterans affairs space, and here's a great example, and this is not VA healthcare, but the Small Business Administration has a program called the Veteran Business Outreach Center. And this is a nationwide network of these centers. We have one here in Colorado, and Senator Bennett actually mentioned the other day in one of his uh, emails that during the testimony of the SBA administrator, when they were talking about this appropriation bill, the bill specifically mentions consolidating 14 different program lines across the SBA into one single program that many people that look at this are concerned that that would heavily reduce the availability of resources for small business owners and potential small business owners. Because one of those programs would be this Veteran Business Outreach Center. And so, despite the fact that she was asked multiple times during the congressional testimony about what was going to happen to the VBOC program, none of the details were provided into that. And so, again, it's one of those areas where you now have a program that's going to be kind of in leeway or in this kind of bubble of uncertainty so that you really don't know what that's going to look like. And the same thing exists across the VA. When you look at all these programs, there's talks about cutting things. And something that sticks out to me is how do you message this? And so two examples that come up would be one, the administration keeps talking about wanting to make sure that they're going to provide services to veterans. Like this isn't going to impact our ability as veterans to get care. In there, though, there's a lot of talk around pushing more towards the community care system. And community care is an important tool for the VA. We need community care. Don't get me wrong on that. But it is not the solution to the alternative of having a well-funded VA. We need a well-funded VA. Community care is a tool in that. So why do that? Why this push towards community care? And the answer really is money, right? So the Republicans view in an ideal world for them, a VA that is essentially an HMO for veterans overseen by the VA. And in order for them to maintain the illusion that they are providing healthcare to veterans, they can't afford to make cuts to VA healthcare. So between hiring freezes, attrition, and really making life miserable, and I've had a couple of conversations with the Federation of American Government Workers. This is the union that would represent VA healthcare workers. Yeah, that's their big concern, is that the climate inside the VA has become very difficult. And so they are seeing increased attrition. They're expecting even more. And they're just not going to backfill those positions. And then they're going to say that, well, they don't have the justification, so they're going to push it off to community care. And on top of that, how do you then achieve these cuts? Who gets cut? Well, we cut these administrators, right? These bureaucrats that are just pushing paper. Well, the paper that's getting pushed here, though, are the claims. And so if you're trying to file a claim, you're going to see that backlog start to go up. And again, same thing that we've seen in the past, when a veteran files claims and that system takes too long, ultimately the veteran, oftentimes gives up. It's not worth my time, which is a shame, because at the end of the day, and again, I think I've used myself as an example several times, right? If you look at, if I walk into a private provider and any number of symptoms I could provide, because I'm a non-smoker, because I'm healthy, I have a good diet, I do all these good things, and every other symptom my body would say, no, this is a perfectly healthy 43-year-old man. They're not going to screen for certain cancers, including the brain cancer that Bo Biden had. It is very uncommon among men of, Bo was not much older than I am. And so for Vietnam veterans, they've already experienced this, where they knew from an early point of dealing with their peers that something that they encountered in their service was causing this increase in cancer. And I guarantee if any Vietnam veterans listen, they know someone that has died from cancer. And it's raised questions throughout the 80s and 90s of just saying, hey, this is not right. But the Reagan administration had made cuts to the VA, made it more difficult for them to get access to those things, and continually denied the fact that these cancers were tied to toxic exposure in Agent Orange. And we have an opportunity to change that. The PACT Act, which was signed by President Biden and pushed through by the Democrats, and I'll say it again, right? This is the bill that Doug Lamborn said where it was too expensive to provide health care to veterans. And what that was supposed to do was to provide that mechanism where, for those of us that served overseas or even domestically, looking at that track record of who was exposed to what and when, and starting to identify those trends early on. So now, when I have a conversation with my VA provider, we're talking about cancers that nobody's going to talk to a 43-year-old man about, because it's not common. But because I was exposed to the burn pits, I have a higher risk of certain brain cancers, of lung cancer, of different types of colorectal cancers as well. And so it requires a different preventative care regimen that's ultimately going to have a better health outcome for me. And by the way, preventative care always saves money in the long run. If you can identify a problem early, the cost to fix it is much less. And so these are the types of things that, without putting it into words, ultimately this is where your cost savings is going to come from. It's going to make it more difficult for veterans to get access to those things. It's going to make it more difficult for the VA to engage in research around some of the big issues that are impacting not only my generation of veterans, but prior generations of veterans, the toxic exposure, the traumatic brain injury. And I think in that Gazette article, I was quoted talking about a veteran who had their traumatic brain injury claim denied because Pete Hegseth had put out some new memorandum talking about restrictions on traumatic brain injury and the diagnoses around it. And I don't think anyone's going to disagree when I say Pete Hegseth is not qualified to be the Secretary of Defense, but he is certainly not qualified to be providing medical advice. And so to think that the administration is making these judgment calls and saying, no, and even though we can tie it back to a specific instance, we're not going to recognize that traumatic brain injury as part of your service-connected disability. And I was talking to this veteran, because they were asking me a bunch of questions, and I said, listen, the difference between a denial and a 0% claim is a big deal. You can be given a service-connected TBI with 0% rating, and that's fine. That probably means that whatever symptoms you're experiencing are not impacting your life. That's a good thing. But what we don't know is what the long-term impacts of that look like. And the worst thing, and I've worked with hundreds, if not thousands of veterans over the past decade to help them get access to benefits. And the very worst thing that happens is when someone comes in and they're fighting a disease. And then we got to tell them, all right, we're going to help you fight the disease, but we also got to fight the VA now. Because now we have to make the connection to the service disabled piece on top of getting you into a treatment plan that's going to address this disease that you're fighting as well. And So that's where claims denials versus a 0% rating is a really, really big deal. So that's one of those areas. Now, this also impacts into the Medicaid population, because if you look at what's going to happen, I think we've talked about the economics of this in the past. Right? So when these Medicaid cuts go into effect, it actually isn't cutting Medicaid. What it's doing is it's changing the way the government is going to reimburse the states. So in certain states, Medicaid dollars are used for different things. A lot of it comes down to preventative care again. And so if the government stops reimbursing the states for those programs, it actually will cause the states to have to take action. So in a state like Colorado, where we have some of those programs that use Medicaid dollars to help improve health outcomes for these populations, and given the budgetary restrictions that we face in Colorado, there is no room in the state budget to continue some of those programs. And ultimately, it will fall on the state legislature will have to make the difficult decisions on how and what cuts to make in order to sustain those programs. And that becomes essentially a political tool for those Republicans that can sit and was the Democrats that cut all those programs. They had to. And so that again supports Republican down ballot races in some states like Colorado, where in 2 years from now they're going to be running on this idea of, the state legislature had to cut that. That was the Democrats. The Democrats cut your Medicaid. They're the ones that went after that, not us. And so Republicans are going to use this as an opportunity to avoid taking responsibility for the decisions that they've made. And in this bill, that's the thing, is it leaves out the details so they can continue to use the nice words on television to say they support these things. But again, follow the money. And at the end of the day, you saw that all of these cuts at federal funding were made to allow for a large tax break to rich families that will not support middle-class families, does not support working families at all. And then when you look at the impact of the tariffs, so the short-term economic impacts of what we're seeing in the tariffs, those prices, again, is a regressive tax. So not only did Republicans in the course of 6 months vote to lower taxes for rich people, they've also raised taxes on middle and working class Americans. And things will get more expensive, and that will disproportionately impact these very populations. So those are two things. But then you already see the Republicans saying, "Oh, no, Walmart's using this as an excuse to jack up their prices." No, that's not what's happening. It's not what's happening. I'm not, by no means am I saying that to defend Walmart, but I see this in the small business community as well. And again, small businesses don't have the volume of sales needed to absorb those price increases. So this is the Republicans, again, empowering the big corporations, the Walmarts of the world, to increase prices and increase profits while essentially crushing small business. And you can go back to the VBOC argument too, of saying, hey, this is a program that is designed to support small business owners, and it is going to be cut. And it's going to restrict the ability for us to deliver services to those military and veteran families that want to start a small business. And I can tell you here in the state of Colorado, in the past 6 months alone, we have had over 12 new veteran-owned small businesses start up in the state with a combined revenue of about $12 million. So these are real dollars that are funneling back into the community that are supporting our military families. And for some of those, I can tell you some of those are military spouse businesses too. So these are military families that are living here in our community that are starting their small businesses here. And that is going to be something that will bring them back in the future. Because if we can invest in those families now, they'll be more likely to spend more time here. They'll want their kids to grow up here. They'll want to retire here. And that's what creates a thriving community for us. I mean, that's ultimately what I want. I want my kids want to grow up here. They want to raise their kids here. And we're not going to do it if we're allowing small businesses to falter, if we're not willing to support them. And that's not a welfare program. There's a strong return on investment in all these programs. And so when I talk about this bill, that's the thing I say. And then, that uncertainty, And then you take into conjunction, because another question that came up was around, there was conversation around a change in VA policy around providing care to people based on marital status, political affiliations, and this is where wording gets issued. So if this doesn't make sense to you, Gary, give me an opportunity to rephrase it, because what the policy shift did, it didn't say that a provider could discriminate on these factors, but it took out the wording that said that you couldn't. And so essentially, yes, you see how, but see, this is that confusing piece, right? That makes no sense, right? So it used to say explicitly that you, as a provider that works for the Veterans Administration, you cannot deny care to someone based on these factors: your marital status, your political affiliation, all those things. And now it removes that and says, well, you can't necessarily, you can't. I can't remember the exact wording how it is in there, but it kind of removes that of just saying, hey, you really can't discriminate, but we're not going to tell you what constitutes discrimination. Which, if you're a lawyer, is an opening for to say, well, that's not discrimination. This doctor's felt that this was not in the right interest of the patient, and so you've opened the door for that. But the real chilling impact is that now you have, especially when it comes to female veterans, to our LGBTQ plus veterans, they're hearing this and they're having this question of saying, and when people come to me and say, Joe, I heard this, can I still get care at the VA? And you have to say, yes, you can. You are 100% entitled to that, and you should go back and continue to get your care at the VA if that's what you want. But how many people don't know me or someone that's well informed to ask that question to? And now they're not seeking care through the VA. And again, it's this idea of, by creating confusion, by creating this culture of unwelcomeness to your non-white male straight dudes in the VA, you're forcing people to make that decision where they feel like the VA isn't for them. And so they're not going there. And that's a benefit that not only they earned, but in the long run is better for them, for their health outcomes. So that is a very long rant on that. Did I answer that question, or did I increase further confusion for you?
Well, it didn't increase any confusion. It mainly opened the door for any provider to the VA to say, I'm not going to treat that person on religious grounds.
Yep.
And I'm going, okay. From the article, what I got out of it, and I always take articles out of the Gazette with a 5-pound bag of salt, because what I got out of it was that Charles Koch has been pushing for decades to privatize the VA.
Yep.
Okay. Follow the bouncing ball here. So now the big bad bill comes along and says, we're going to perform these cuts to the VA. But we also want the patients of the VA to go downtown basically for their health care. And you say, well, that's got possibilities. Now you flip it around and you say, oh, we're going to be performing cuts to Medicaid and possibly Medicare. Okay, you've got 79,000 plus veterans in this town, which are going to be affected. Mm-hmm. I know not all of them are going to the VA, or when I drive by there, I see the parking lot full and guys standing out the door. But with the cuts in the Medicaid, that means it's going to be cutting services on the civilian side of the house.
Yeah. And
also layoffs in the provider care area. And another area that's going to get hit, I guess you could say this is 3 bounce, is the rural areas.
Mm-hmm.
And there's a lot of veterans that need the VA facilities that live in rural areas that are possibly right now being taken care of by the private sector. But then in our case here in the Colorado 5th District, we've got Pikes Peak Regional Hospital in Woodland Park, Lincoln Health Community Hospital in Hugo, Heart of the Rockies Regional Medical Center in Salida, other facilities in Canyon City, Callahan, Florence, and Buena Vista that could possibly be facing closure, which would deprive the VA veterans of health care. So, I mean, this is, to me, I just opened the aperture up a little bit, saying, well, yeah, you can go ahead and cut the VA, and this is what's going to happen, but the patient can go ahead and go to the civilian side of the house and be taken care of. Not really.
Not really. Well,
not really.
And let me further open that aperture, because we've talked about, again, as someone who's worked in the nonprofit healthcare space, right? How do you create a cost model around these assumptions, right? So language is really important in this case, right? So in the United States of America, we have universal healthcare. Okay, we do. If you show up to the hospital, it is a law that the hospital must treat you to a certain standard of care. And that's not necessarily saying that's a good standard of care, but the law says you show up, you get treated, always. Now, that treatment, if you show up without insurance, is almost always happening in the emergency department.
Right.
It is going to be substandard, and it is almost always at a point in that disease that you have the patient has reached a point where they have no other option but go to the emergency room. So that is the most expensive, least effective time frame to get that care. So that's on the outcome side for the patient. This is bad. Now, if you're the hospital and you're designing out your cost structure, and you know that Medicare, Medicaid only will reimburse between 75 and 85% of cost.
Right.
Okay. So then I get a private insurer, which is always negotiated separately. So this is the in-network, out-of-network piece. These are negotiations that happen between the hospital network and the private insurers. If you're a hospital, what you do is essentially you look at the loss that you would take off of treating a Medicare, Medicaid patient. You look at the assumptions on how many people are going to walk through the door with no ability to pay whatsoever, right? That's a sunk cost. And you roll it into the overhead cost of the hospital. And so then when I'm billing that out, when I'm trying to bill out what is my actual cost, then that cost structure incorporates the lost, the no payment people that are showing up without any sort of health insurance. And so when you go back to the payers and negotiate that, generally speaking, as a private payer, when you pay through private insurance, your insurer is probably paying about 120 to 130% of the actual cost. Go ahead, Jerry.
Time out. For the veterans that have Medicare Advantage plans,
yes,
I would suggest they go online to Mr. Google and plug in which insurance companies are not paying their bills.
Yeah.
And it's the Medicare Advantage plans that are denying treatment and not paying bills. And I think it'll be a shock, and that's another point of the aperture opening up and saying, even if you have, quote, these plans being, on Medicare and Advantage, these Advantage plans, you're going to get screwed.
Yeah.
Plain and simple.
And your premiums are going up, and we're already seeing that too.
Right.
Where I think it was in a couple of different states, you're already seeing the reaction of private insurers because now a perceived risk, right? They know the economics here, and so they're trying to get ahead of the game by raising rates on private insurers, on the privately insured, to make sure they can eat that cost.
Right.
And so again, it's another one of those, this is a regressive tax that targets middle and working class families. Because at the end of the day, right, you're going to be paying more out of pocket for healthcare. And it's because, again, it was to pay for a tax cut to those making over $1 million a year.
Well, this is also going to affect your nonprofit SBA loans to veteran businesses because now all of a sudden they have an increased overhead cost through medical insurance because they're
Yes.
going to get hiked. I mean, the vet himself may be covered okay temporarily under the VA, but if he's got a wife and 14 kids, uh, hello?
Yep. And yeah, and it's, for small business owners, you know, that is a cost, that is a substantial cost that's going to start playing into that. And again, that's another cost that gets paid by your working and middle class families. Um, and so all to benefit those making over $1 million a year. And it really is sad because when you look at people like Warren Buffett, and Warren Buffett for years has been saying, add a tax bracket, add two tax brackets. And that alone, and go back to the time frames when America was most prosperous, and you saw that sliding scale tax system go way, way, way above 60, 70, 80%.
Mhm.
But that was only paid by the highest level, highest income earners in the country. And but they could afford to do it.
Right.
And and they were willing to do it because they recognized that there was value in investing through taxes in their community. There was value in doing these things, and they knew that the rising tide raises all boats, and the difference is that the Reagan era came in and said, "Oh no, you support the rich, and that money will trickle off the table." And
Yeah.
you all can benefit from the scraps from the tables of the rich.
Yeah.
That will lead to a successful economy. And
Well, one of the conclusions I'll come up with is that the big bad bill, the BBB, will impact everybody, whether they're the VA receiver of medical care
Mhm.
or whether they're in the civilian side of the house.
Yeah.
It's everybody's going to get upset. I mean,
and
there's no winners in this at all as far as the health care goes of the country.
nobody wins. And again, it's one of those, and I can't figure it out. Is it? Well, actually, no. We have the answer to this because President Trump said, hey, looking at the math on this, creating a 40% tax bracket for those making over $1 million would solve this problem. And Mike
Mm-hmm.
Johnson comes back and says, no, we're principally against tax increases for the rich. And so, yes, despite the fact that every bit of economic data, just every bit of basic math says do this, but the Republican Party is just like, no, we're not. That's not how we operate. We're supposed to support the rich. And even though it's going to tank the economy, because you look at all those costs, and
Yeah.
and you're already seeing it, right? Those of us that work paycheck to paycheck, you're making those cost decisions. You're putting off things like vacations and other spending because
Car
car
repairs.
repairs, all of these things. And it might not be because the financial situation has hit yet, but the uncertainty has. And so you start to have the questions like, ooh, the car's getting a little rough. Like, do I buy a car now, or what happens with the tariffs? Like, what do I do?
Yeah, well, if we wait till December, that vehicle will be $8,000 more than today.
Right? And it creates an impossible
Yeah.
choice for your middle and working class families. And when that happens, every single time when consumer confidence falls, the market fails.
Yeah.
And so, like I said, how many times has Donald Trump bankrupted a company? Like that is how he runs a business, right? I'm gonna run this company up with debt, and then I'm gonna declare bankruptcy and walk away and leave the people that made everything happen out in the dust. He has screwed over countless
Right.
unions, contractors, workers, all these folks. That is literally how he has run his business for his entire life, of completely avoiding responsibility for his ineptitude.
Right.
And now, I mean, you know me. I'm not the type of person. I really try to avoid getting into the conversations around someone's mental abilities, but there's a lot of really unnerving articles out there about in public conversations. You look at the president, you're saying, "Do you even know who you are right now? Like, what are you talking about? It's
Well,
gibberish."
I have to tell you a confession here.
Mm-hmm.
I was in the Navy for 28 and a half years, and I was a flyer, and lack of oxygen, basically. So I'm certifiable. So, it's not a cross we have to bear. It's something we got to do to change it. And, I put my phone number in for Jeff Crank's town hall meeting last night. And guess what? There was no town hall meeting. So old Jeff baby is running away from his constituents again, because these are things that we should be discussing with him. We need to hear his point of view.
Well, he can't be. I would, in defense of Jeff.
Oh, don't do that.
I am. I'm going to do
No,
this.
don't do
He's
it,
not.
Fendi.
He's not running away. Because to run away from his constituents, he would have had to be near them in the first place, and he's never been there. Right? This is a Washington insider he doesn't need to run away. He's never been here. He's not here. He didn't care.
Well, I can go along with he doesn't care. But other than that, Joe, we've smoked through another 30-minute segment here.
Yeah.
Got any last thoughts before I sign us off?
I guess you're going to get you'll get you've heard it here first.
Okay.
On August 22nd, mark your calendars.
Okay.
We are going to do. It's kind of weird. The campaign launch parties have always been weird to me, because you have these campaign launch parties. It's like, you've already been campaigning for a year. What are you launching? You're launched. You're gone. Done. Out there. But August 22nd at the Cottonwood Center for the Arts, 6 to 8 p.m. we'll have the formal launch party for Reagan for Congress 2026, and we're really excited. It should be a lot of fun. If you're familiar with where the Cottonwood Center is, do you know?
It's in the Cottonwoods.
No, it's downtown. It is right across from Jeff Crank's office. And so I look forward to seeing a parade of people walking in to launch this campaign. Whether he's here or not, someone will hopefully take note of the fact that, hey, the people in this town know better, and they are not behind this. And we're gonna. I don't even like using the term "flip the district" anymore, right? It's not about flipping. It's about just providing good representation and leadership. And it ain't rocket science, people. It really isn't. It's just a willingness to be there.
If I can do it, you can do
it. but don't. We don't need more people in the race. We need to consolidate early. Let's do this.
Okay. Okay, website?
ReaganForColorado.com.
Coin appreciated? Coin of the realm.
Coin of the what?
Coin of the realm.
Oh.
Money.
Oh yeah. Well, always money makes us go. And I think I talked about this last time we did this, but we've started to staff up. We've got really for this early a really impressive machine going here for this campaign. So really excited. We had some good early investment, and that's allowed us to make some really good choices. And that's why I'm excited. Like I said, that's why it feels weird to say, oh, this is a launch. It's like, we're in orbit, baby. We're ready to go.
Well, I got to add this. Don't forget to look for us on YouTube under Joe Reagan's Conversations.
All right.
I think we've got 12 episodes up. This should be number 13.
Lucky 13.
Lucky 13. So thank you, Joe, and
thanks, Gary.
Thank you, listeners. This is another episode of Joe Reagan's Conversations. Look for us on YouTube, Spotify, Amazon, Apple, and anywhere else we can stuff this show.
Share it with your friends, too.
Okay. Thank you so very much, Joe.
Thank you. Good night, everybody.